Last week we had the pleasure of treating a monkey. And a monkey is a cool animal. Even for a vet, monkeys are cool. You can't help but fall in love with the little human faces and the little human hands. They're incredibly cute, especially small squirrel monkeys. Now Jake is a squirrel monkey from a local safari park, a wildlife park, Kumartin Wildlife Park. He's actually incredibly cute, isn't he? Now Jake's problem has been one of chronic nasal discharge from one of his nostrils. He's had sort of bloody, pussy material coming out of it. And it's been going on for a little while, and despite efforts, it's not been clear what might be underlying these signs. Now one problem that can cause these is a disease around a tooth root. And with this in mind, I arranged Jake to come and see me at our specialist dental suite at Roundswell. Now Jake certainly doesn't have very pretty teeth, but there's nothing, just looking at what you've got on the surface there, nothing which could definitely tell you why you've got a chronic nasal discharge. So we're using dental x-rays, and dental x-rays are amazing things. We've got this amazing unit at Roundswell where we just get, with a push of a button, this instant picture of what's happening below the gum line. After carefully positioning Jake, we click our button, and boom, we can see what the problem is. All of a sudden, we can identify that there's a retained root in Jake's jawbone, and there's a serious infection going on around it. It's going to be uncomfortable, and it's going to be the source of the problems, and if we can deal with it, that should be Jake feeling a lot happier. First step after identifying where the problem is to try and get access. After carefully cutting the shape with a scalpel blade, we raise a flap with a periosteal elevator. This pushes the soft tissue away from the jawbone, giving us access to the jawbone and also that horrible hole right through the middle of it. Just look how easily this dental probe is able to pass up from the oral cavity into the nasal cavity. This is what the problem has been. And it's within this hole that we're going to find our root fragment. It sounds simple enough, but even though we know where to look, it can be a fiddly business. Once located, it doesn't actually take that much getting out. The tissue which usually holds in the tooth roots has long rotted away, so a gentle tug with forceps and out it pops. You can actually see the slimy pink tissue around it. Would have once been a very tough ligament, but now it's just nothing, it's rubbish. If you're a dentist watching this, or you're a keen eye, you might be thinking, hey, what about that discoloured broken incisor next door? Well, we haven't forgotten about that. This, if left, would lead to a problem very similar to the one that we've just seen. So we're removing this in the same dental operation. This is going to be a bit more of a solid tooth and will take some drilling out. The bone around the root drilled away, we now need to break down the soft tissue.
What I'm doing now with this luxator, it's like a long sharp knife, and it cuts all the attachments that a tooth might have. Now rotten teeth have less attachments because they've rotted away, but they still need some breaking up. And when it's nice and wobbly, we can usually just give it a tug, and there's our tooth. Can you just have a close-up of that? Just tap the screen again.
If you're worried about dental drills and tooth extractions, then I don't blame you, but fear not. Jake is not only under general anaesthetic, he's also received local nerve blocks, which just means he's going to be recovering in comfort once he comes round from his general anaesthetic. Now all we need to do, the problem teeth removed, is sew down that flap we raised initially. And this is the fiddliest part of the whole operation, and Jake should have a really great recovery and no more nasal discharge.
I hope you watched the video, I hope you found it interesting, but I'm well aware it was the monkey that probably kept your attention. I was a bit naughty using the monkey for this. The point we're trying to make here is that a broken tooth in any animal's mouth, so not just a monkey but little dogs here like Wilson the Whippet, a broken tooth can lead to really serious ongoing problems and chronic pain. We've sorted Jake out today, but you know, they do need attention, these broken teeth. So give us a call if you've got any questions, and we'll be able to help.